You guys work out at all? Exercise, yoga, a little bit, couch surfing, that's about it. So we'll talk a little bit about the effects on exercise and the muscle and why we fatigue or why the muscles fatigue. Contraction and relaxation. So muscle is actually like a mechanical device. It's like a ratchet system where the muscles step by step get smaller and bigger. What was it 206 bones? It's 600 plus individual muscles. So don't worry too much about the individual names. We'll talk about the large and the main muscle groups. Functions. So with the skeletal system, it allows for movement because the muscles need to pull against something. What attaches muscle to bone? Tendon. Very good. Muscle to bone. Good. Now you guys did bones last week. What attaches bone to bone? Ligaments, right? So at the end there's cartilage. So yeah, you are correct. At the end of joints there is cartilage, but connecting the bones and keeping them together are ligaments. Now what connects muscle to muscle? So we'll learn it. We'll learn it in a little bit in subsequent slides. But keep that in mind. Muscle to bone, bone to bone, now muscle to muscle. Stability. You don't know there's an injury until there's an injury. Think about your neck muscle. Right? So when your neck muscle keeps your head up. So there's muscles in the front of your neck and muscles in the back. And they're always working, but you don't even feel it because they're balanced and they keep your head upright. The only time you notice it is if one of those muscles get damaged, like if you sleep on your pillow wrong or you get whiplash from a car ride, that's when one of your muscles work and the other one doesn't, and it hurts just to move your head up or down. So that's what they mean by stability. And then all of your sphincter control, they're by muscles, circular muscles. Very important, sugar and oxygen is burned in your muscle, and that releases heat and our ATP molecule, which is our energy molecule. So in the body we use adenosine triphosphate as energy. So the muscles will use sugar, burn it with oxygen, producing heat. So when you're cold, that's why you shiver. Skeletal muscles to bone attached by tendons. Very good. And then when the muscles get larger and smaller, contraction and relaxation, that causes movement. For smooth muscles, all of your organs are pretty much smooth muscle and they're not under your control. So it's involuntary contraction. Same with the cardiac muscle, which is your heart muscle. It is also involuntary. You normally can't control either of these two. Stability. Another part for stability is your spinal column. All the little muscles in between your vertebrae actually keep your vertebrae upright and straight. For a lot of people who have curvature to the spine, the doctor will recommend exercise to strengthen those muscles to keep the vertebrae aligned. We already mentioned the heat production, so burning of sugar. So what is normal body temperature? Yeah, so it's about 98.7, 98.6. So it's anywhere 1 or 2 degrees within that range. Sphincter, so those are the circular valves. There are some weak sphincters, like your cardiac sphincter from the esophagus to the stomach. And then there are some stronger sphincters, like the pyloric sphincter, that leads from your stomach to the small intestines. Myo. What does myo mean? Muscle, all right. And then cyte just means cell. So a myocyte is a muscle cell, which is the same thing as saying a muscle fiber. Sometimes there's one nucleus, sometimes there might be two or three or multiple, right? So a little bit different from what we've been learning about cells. So all these terms, when we get to the image, it'll make it a lot easier. So a very important structure is the cycling of calcium. And calcium is involved in muscle contraction. If there is no calcium, you can't relax and contract muscles. Very important for contraction. So the end or sarcoplasmic reticulum will hold on to that calcium and release it when it's needed. The muscle fibers are called the myofilaments, right? The muscle fibers. So we have actin and myosin fibers. All right, the coverings. We'll go from largest to smallest. So the largest is the entire muscle. Every entire muscle is surrounded by a covering, right? So this covering is called the fascia. Right? So if you ever eaten like a chicken drumstick, you can kind of peel the muscles, individually separate them because it has a covering. That's the fascia. So epi means above. So the epimysium, so myo is in there as well. So on top of the muscle is the epimysium, and that's going to cover the most muscle. Now, each muscle is made up of bundles of muscle fibers. So those are going to be called the fascicles. So in between, you have the endomysium. So they use a lot of those prefixes. Epi is the top layer, and that's the most covering. Endo, within. So it's all this stuff within. And then surrounding each fiber, you have the sarcolemma. Right? So from largest to smallest. So the most is fascia, right? Epimysium, endomysium, and then every muscle fiber is surrounded by a sarcolemma. So remember that term lemma, kind of like lamination, layers. I think you'll need to be able to organize muscle from largest to smallest. So this slide just organizes the types of muscles. So of course skeletal is the only voluntary one. Smooth muscle, think of all your organs. And then cardiac, of course, involuntary. You can't normally control your heart rate, but there's certain things you can do that can slow it down. Biofeedback techniques. Neurotransmitter. So anytime a neuron fires, a nerve cell fires, it sends an electrical signal down the tail and it releases chemicals. And depending on the chemical that is released will determine the action. And in the case of skeletal muscle, if it releases acetylcholine, then it's going to cause a contraction. Right? So this is action, causes action. Now, once that action taken place, we need to break down this neurotransmitter. Right? So once it's detected by the muscle, we got to break it down. Otherwise, our muscle will be stiff all the time. Right? It needs to be able to relax for that cycling. So we have this enzyme, right? And the enzyme's name tells you what it breaks down. It breaks down acetylcholine. So we have the chemical that tells your muscle to activate, and then we need the enzyme to tell your muscle to stop by breaking down the chemical. Then you have your muscle relax. Do you guys know what rigor mortis is? Rigor? When a dead body gets stiff? Yeah. So they know when you die based on when rigor mortis sets in, because during rigor mortis, you're no longer cycling nutrients and you're no longer cycling energy. So now all the muscles are stuck in rigor mortis and become stiff. Visceral. So when you hear visceral, what do you think of? Organs, right? Your smooth muscles. This is not under your normal control. And yes, they also respond to acetylcholine, but they also respond to norepi. And norepinephrine is from your adrenal gland. Very similar to epinephrine and adrenaline. Peri is around. Stultus is movement. So because your GI tract is one tube, when we have contraction, we're going to have contraction around the tube. And that's what allows for food to be propelled through your GI tract. Cardiac muscle. So they do have a special feature on them called intercalated discs. So normally you would have cell membrane covering every muscle cell, but in the case of cardiac muscle, you have very loose gap junctions called intercalated discs. And what this allows is it's allow for the rapid flow of nutrients, in this case electrolytes. So if you have electrolytes moving quickly, then the heart muscle can beat quickly. If it's impeded by cell membrane, then that electrical signal would stop every time it hit a heart muscle, and the heart wouldn't really contract. Heart is self-exciting. You have the sinoatrial node in your right atrium, and what it does is it gives you about a 60 beat per minute pace all by itself. Have you guys seen in the movies where if you take the heart out of the body, it continues to beat? Is that real or fake? Yeah, it's real because of the sinoatrial node. It does not need a signal from the brain. The brain will just tell it to go faster or slower, but as long as the pacemaker, the sinoatrial node, is intact, it'll continue to beat. The heart responds to acetylcholine, just like muscle, skeletal muscle. Energy, ATP, adenosine triphosphate. All you have to know is that's our energy molecule. Anytime we need to use any source of power, we use it in the form of ATP. So we don't use electricity in our body, we use ATP energy. Any bodybuilders in the audience? Anybody gone to the gym lately? Anybody knows about supplements? So creatine phosphate is an energy intermediate, and what it allows your body to do is to recover ATP. So if you're working out, you're using up ATP, and you don't have enough fuel in the form of ATP, your muscle is going to poop out. So bodybuilders, people who work out, they'll take creatine supplement in order for their body and muscles to recover energy molecules so they can continue working out. Aerobic, with or without oxygen? Aerobic, with or without? No, this is with. Anaerobic, A-N. Anaerobic is without. So when we do aerobic exercise, sweat into the 90s, sweat into the 80s, we're breathing while we're exercising. We're taking in oxygen. This is very efficient. However, when we're doing anaerobic, no oxygen, very inefficient. So we're going to build up byproducts, in this case lactic acid. That burn you feel when you're working out, that's because there's low oxygen and you're building up toxins because of that lack of oxygen. So when you have a cramp, low oxygen, buildup of lactic acid. That's in a muscle. What if it's in your heart? What if you have a cramp in your heart? That's angina. That's just chest pain due to low oxygen, probably buildup of the byproducts as well. So oxygen day. So right now you're saturated anywhere 95% plus oxygen saturation. So once you start using your muscles, burning oxygen, using sugar fuel, then that oxygen is going to go down. So it's going to go down relatively low. So your body will start breaking down byproducts without oxygen. That leads to buildup of lactic acid and then muscle fatigue. So if you want good stamina, like marathon runners, triathlon cyclists, then you have to train your body to get rid of lactic acid so it doesn't build up and your muscle doesn't shut down. So you're gonna have to eat, fuel yourself, and replenish oxygen throughout the entire marathon. So muscle will slow down once you lose enough oxygen. That debt becomes larger, and then all of a sudden you hit the wall. Have you guys ever ran a marathon? You guys ever heard of hitting the wall? So let's see, 140 if you're crazy, 70.3 if you're half crazy. What is it, 26? 26.2, that's a marathon. 13.1 is a half. So if you want to do an Ironman, a full Ironman, that's 140 miles. So once all your fuel is gone, all your oxygen is gone, and your body can't go anymore, you either get that adrenaline rush that gives you the runner's high, or you hit the wall and your body shuts down. There's nothing you can do.
What's the guy that I forgot his name? Supposedly he ran the 140 like 3 times in a row, back to back.
3 days in a row?
Think,
Something like that? Yeah, that's doable.
They hit him on
No, there's a guy that did 30 for 30. He did 30 triathlons in 30 days. On the second day, he broke his hip, and then he tried again. Some crazy European dude. I know there's some crazy guy, yeah.
Oh yeah, he's an American dude that did it, and he doesn't get the lactic acid built up, and he just runs and runs. And supposedly he was like a businessman on his 30th birthday.
He decided to do it.
He ran with his shoes on. He ran 30 miles that night.
Crazy. Yeah, some people just genetic freaks for some reason. Yeah, there's other crazy events like the Berkeley where you're hiking in the woods and it's a 100-mile race hike. But there's people that can do it. They train their body, pretty crazy feats. All right, major organs of the muscle system. We'll go over the major muscles. Well, of course, connective tissue, muscle itself, blood, nerves, and then we'll answer what connects muscle to muscle. Because if it didn't, look at those nice abs, man. If we didn't have muscles connecting to muscles, we wouldn't have abs. All right, so covering the muscle is that fascia. That's that top coating. Connecting the muscle to bone is the tendon. And in your abs, right, you got little short muscles that are connected together via connective tissue in between. So that's what gives you that six-pack. So that stuff is called aponeurosis. So on the top of your head right here, all the muscles on your face, they attach to the aponeurosis on the top of your head. And then on your outer thigh, right, you also have a band, the iliotibial band. That's a connective tissue where all the muscles attach there in your outer thigh as well. So connecting muscle to muscle, aponeurosis. Epimysium, largest covering, similar to the fascia. Perimysium, it's going to cover the fascicles. And then endomysium is going to cover every single muscle fiber. So largest to smallest. Attachment. So movement versus non-movement. So the attachment site that does not move is the origin. So here in your bicep, the origin is here. So when you flex your arm, this angle gets bigger and smaller here. So this part does not move. Whereas here, this angle moves a lot. So this is going to be the insertion. Origin and insertion. Agonist. Is that with or against? That's with. Antagonist. So aerobic, anaerobic, an is without. So agonist is with. So moving together. Synergist, same thing. Moving together. Against is antagonist. So opposite. So antagonists to your biceps in your upper arm are your triceps in the back of your upper arm. So in your leg you have your hamstrings. What's antagonist to the hamstrings? Your quads in the front of the leg. Flexion. Does the angle get larger or smaller? Remember starting anatomical position? And then I asked you to flex everything. So the angle gets smaller. There you guys remember. Extension, the angle gets larger. So when they tell you which muscle groups extend, which muscle groups flex, you know where they're located, right? So here on my hand, which muscle groups extend the fingers? Which muscle groups flex the fingers? So on the top of the hand, do they flex or extend? They extend, right? So if these muscles get smaller, they extend the fingers. So on the bottom, these are flexors, because when they contract, they get the angle smaller. Extensor muscles are all up here. Flexor muscles are all down here. So don't worry about the exact location or exactly where they are. Just know top of the hand or bottom of the hand. Hyperextension, that's when you overextend. Dorsiflexion only has to do with the feet. So this is the pointing the toes up. And plantar flexion only has to do with the feet. That's pointing the toes down. So the bottom of the feet is their plantar surface. And then dorsal is the back of the foot. Ab. When you're abducted, what happens to you? You are taken away, right? Like an alien abduction, you're taken away from Earth. You're a child abducted, they're taken away from the family. So when you have an abductor muscle, it takes the body part away, right? So this is my abductor muscles working, taking my arm away. So when your legs, you're doing your abductor exercise, you're taking your leg away from your body. If you are an addict, what happens to you? You are drawn towards, right? So if I'm an addict, alcoholic, I'm drawn towards the substance. So if I take the body part towards the main line, then that's an abductor muscle. Dorsiflexion, toes up. Plantar flexion, toes down. Extension, the angle gets bigger. Flexion, the angle gets smaller. Adduction, add towards the body. Abduction, alien abduction, taken away. Rotation, so this is just about the axis. So you're doing this motion here with rotation. Circumduction, you're rotating here. So you got to know these terms because you got to describe what the patient can and cannot do and what do they do that causes pain. Pain upon rotation, no pain when left arm is circumducted. Right? That way you can describe to the physician exactly the action. Pronation, supination. Pronation, palm down. Supination, palm up. Inversion, eversion only has to do with the ankles. So inversion is when you turn your ankles in. Eversion with an E is when you turn your ankles out. Retraction, so I think the example they used was the neck. So if you put your like your neck forward or your neck back, that's protraction, retraction. So maybe more like cat claws. Do you guys know how to take out your claws? So for cats to take out their claws, they gotta flex muscles on this side and flex muscle on this side to get their claws out. So it's conscious for them to take out their claws. Elevation, like your shoulders. Shoulders up, depression, shoulder down. Here, inversion, inward, turning in, eversion, outward, turning of your ankle. Elevation up, depression down. Muscles. So the name for the muscles is based on the location. And location is usually determined by the names of the bone. So if you have a good grasp on bone names, it's going to make your muscle names a lot easier. Because a lot of the times, they'll name the muscle based on what bones it attached to. For example, sternocleidomastoid. Point to your sternum. Point to your clavicle. Where does your sternum and clavicle attach to each other? And then point to your mastoid process. So here's your clavicle, here's your sternum, here's where it attaches. It starts here and it attaches at your mastoid process. Sternocleidomastoid, that muscle that goes from here to here. Right, so once you know the bone names, it'll make the muscle names a lot easier. Size, big, small, if there's one piece, two piece. Action, abductor muscle, flexor muscle. Right, now you guys know the terms. Shape, is it triangular shape? Does it look like a trapezoid? Is it flat? Does it look like a blanket? Does it look like a tendon? Right, so they'll name it based on size and shape as well. Location, size, shape. So memorize this image. Everyone has a photographic memory, so make sure you use it now. Go. Blink a couple times. Every time you blink, it's like a shutter, and then you get in photographic memory. So I'm just kidding. Make sure you're familiar with them. These are the common ones, and probably the start to what you should be familiar with. So frontal bone, that's easy. We already got that. The muscle for chewing, that's your masseter. We talked about the sternocleidomastoid, connects the sternum clavicle to the mastoid. Deltoid means triangle. So that shoulder muscle is triangle shape. What shape do you think is the rhomboid? It's rhomboid shape. Your traps? Well, it is trapezoid shape. Your trapezius. Lattice, your your latissimus dorsi. So lat means your lateral, so it's towards your side, and it's on your back. So those are your lats. So just get familiar with as many of these muscles as possible. All right, we're gonna go now to the different groups. We'll probably finish up the muscles in the head region, take a break, and then we'll finish up the rest of it. So the sternocleidomastoid, I use that as the example. We already know where that attaches. Capitis, where do you guys think this one's gonna be? Somewhere on your head, right? So frontalis, where the front bone is, that's the front muscle. Oris, so is that the oral cavity or the eyes? Is that oculus? Is that the oral cavity or the eyes? 50-50. Right. So that's the round muscles. So this allows you to pucker, this allows you to squint. Zygomaticis. So we know where the zygomatic bone is. It makes that little arch with the temporal bone. So that muscle that goes right underneath. Flat muscle, right? The muscle right here on your neck, it's kind of flat. So they call it platytisma, right? It's not the sternocleidomastoid, it's that flat one right here, that wide band. Mastication, the chewing muscle. And then when you bite down and you feel here in your temporal area, the muscle that flex, that's your temporalis. Pectoralis. So your chest muscles. You have the minor and major pectoralis. Lats. So that means it's towards the outer portion of your body and on the back side. So those are your wings. Not bat wings, but your back wings. Deltoid. That's triangular shape in your shoulder. That's where we administer the flu shot. Sub. Below. What's the scapula? The shoulder blade, right? So this is the muscle below the shoulder blade. Infra. What's infra? Below or above? Above, right? So sub is below, infra. So here's above the spine. So the spine of the scapula. Biceps. How many are there? Two muscles, right? Two muscles. So it's biceps. That's why there's two, because there's two muscles. Plural. Biceps brachii. Because it's in your brachial region. Your upper arm here is your brachial region. So it's the two muscles in your upper arm region. Biceps brachii. Brachialis. That's the muscle in your upper arm. Which side is this on? Pinky side or thumb side? Radius. Pinky side or thumb side? Yeah, the thumb side rotates over. So this is the muscle that's on the thumb side, right? Triceps. How many muscles? So this is the one in the back of the arm right here. Right? So in the upper arm. 3 muscles in the upper arm. And then the supinator, palm up or palm down? Palm up, right? So this muscle allows you to push your palm up, right? Terminology. Pronator, palm down or palm up? Palm down. Right? So learn the terms. It'll tell you what the action of the muscles are. And then just logically think about, hey, where does the muscle need to be on my body to do that action? So that's better than memorizing, because it's too many to memorize. But if you think about action and what it does, it should come to you easier. All right, flexor. Okay. Top of the hand or back at the bottom of the hand if they're flexors? Bottom. Pinky side or thumb side? Radio. Thumb side, right? Makes it that easy, right? Here in the wrist area on your thumb side, they flex the fingers, right? They flex the wrist. Here is on the pinky side, right? Makes your life a lot easier. Once you know the bones, then once you know what those words mean, the names for the muscle is a lot easier. Where do you think that is? Palm side, front. Yeah. So go like this with your pinky and thumb. And then if you have the tendon that rises up, then you have your palmus longus. If you do not have your tendon, then you're like 10% of the people that don't have that muscle. When you pop a tendon in your fingers and hands, and they need like a donor tendon, they'll usually take that tendon if you have it, and they'll use that to graft and repair other tendons. So this is going to be on the palm side that flex the fingers, right? Here, carpi is wrist. These flex the wrist. Extensor, now it's going to be on the back side because they extend, right? So this extends the wrists on the thumb side. This extends the wrists on the pinky side. And this extends the fingers. Digits are the fingers. So if you try to memorize everything, you're going to get lost. If you just know what the terms mean and apply it to where it is in the body, it'll make it a lot easier. So don't worry about me blocking out these names and having you fill in the names. You just have to know relatively where they are on the body. All right. Continue on. The diaphragm. Of course, it separates the thoracic and the abdominal cavities. What type of muscle is the diaphragm? Smooth muscle. Very good. So we don't need to think about it. It goes on its own. Our involuntary nervous system will control it. The brain will tell it to slow down or speed up. What you do to control your breath is you move all the skeletal muscles. So the intercostal muscles, the muscles in between your ribs, and your chest muscles. Internal, external, so the in-between ribs. Inter is between, coastal is rib. Your abs. You actually have 4 layers of ab muscles. So the ones that give you your 6 packs, that's the rectus muscles. Rectus just means straight up and down. And then you have the ones that go side to side, left and right. So the rectus muscles are your 6 pack. They run up and down. Transverse, go up and down. And then your obliques, they make a V-shaped pattern. And overlaying that is an A-frame pattern. So you have 4 layers of abdominal muscles. The pectoral girdle. Trapezius. So a trapezoid is this shape. So if you work out your neck muscles, you'll get that defined trapezoidal shape. So we're going to work out your traps. You're going to do those shoulder shrugs, right? Pectoralis minor, major, they're your chest muscles. What shape is deltoid? Triangle. Which way does rectus muscles go? Yeah. Transverse, which way do they go? Yeah, side to side, left. And then you can see here the external obliques, they go this way to make a V frame. And then the internal obliques, they make an A frame. Serratus. Seen those knives with teeth on them? Serrations. So these muscles right here look like the serration of the knife. So they call it the serratus muscles. Sternocleidomastoid, guess where it connects? On the sternum, the clavicle, and it connects up behind the ear at the mastoid process. What shape is trapezoid? That shape. So if you work out these muscles, you'll get that trapezoidal shape. Your groin muscle, so your psoas muscle, iliopsoas, where your hip bone is. Gluteus maximus, gluteus minimus, and you also have a ventrogluteal. Adductor, towards or away? Towards. When you're addicted, you're drawn towards. So this is going to draw the leg towards the midline of the body. Hamstrings. So very important. What are pigs in a blanket? Hot dog in a crescent roll or whatever, right? So your hamstrings are in the front or the back of your leg? The back of your leg. Very good. How many in bi? 2, right? And then you have something that looks like a tendon. So does the tendon look like a string or is it flat? String, right? So here's the semitenaneous. So there's a muscle that looks like a long string. And then a membrane. Does it look like a string or is it nice and flat? Nice and flat. So that's semimembranous. So the hamstrings, you got the pig in the blanket, right? You got the little roll that's wrapped in the sheet. So you have the bicep femoris and the semitenaneous and the semimembranous. Now rectus. So that means it's going to make the leg go straight, right? So this means it's going to be on the front side. So these are your quads, right? So just think about it logically. If this makes my leg stand up, then it has to be on the front. So those are your quads. Ladder, that's the outer thigh, vatus lateralis. The middle thigh. So torus, this is going to be the longest muscle in your body. It connects from your hip, from your iliac crest, all the way to the front of your shin. Tibia, which bone is that? Shin, right? Anterior, is that front or back? Front. So this is the muscle that's in the front of your tibia. This is the muscle in the front of your shin bone. Extend the toes. Shin side or calf side if I extend the toes? If you extend the toes. So it's going to be the shin side. Gastrocnemius, that's your calf muscle. Psoas, that's in the front. Another one in the front of the muscle. And then if it flexes the toes, then it's going to be on the plantar side, right? Makes the angles of the toes smaller. Aging, you lose muscle. That means you cannot make heat. So in your reception area, in your waiting room for elderly patient, you're going to have to make it a little bit warmer. Now because you have less muscle, you're burning less fuel, so you need less food. So a lot of adults will tend to gain weight because they don't adjust their calorie intake. Dexterity, yep. In their hands, they lose strength. So one way to help them is do a lot of exercise. And for the aging patients, they tend not to pick up their feet when they walk. They tend to shuffle. And when you shuffle your feet, that's when you tend to trip and fall. So have them build their leg muscles and have them step instead of shuffling to save energy and strength. You guys heard of Botox? What's Botox? Injection. Yeah, what is it used for? What does it do?
Take out the wrinkles.
Takes out the wrinkles how? Magically?
Puts it underneath the wrinkle to...
No, it's not a filler. Botox is not a filler. Tox stands for toxin. You guys know that? It's a neurotoxin. It paralyzes the nerves in the face. So when you smile or frown, your face does not move because it is paralyzed by the toxin. So it's bacteria. And commonly, back when they had poor standards, if you had canned foods that were contaminated, they weren't sterilized properly, you'd get botulism, paralysis, death, right? So the same exact thing, they shoot in their face, numbs the nerves, they don't have wrinkles. Also, they use Botox for migraines. So if you paralyze some of the nerves and the muscles of the head, it will prevent migraines. Fibro, is muscle, algia is pain. So it's going to cause a lot of muscle pain. Fibromyalgia. Kind of feels like pins and needles a little bit. Muscular dystrophy is abnormal and dysfunctional. Trophy is nutrition or growth. So here you're going to get a lot of weakness, loss of muscle tissue and weakness. Is muscle. A is without. Asthenia is sensation. So now you're going to have no muscle sensation. So no muscle tone. CrossFit. Anybody done CrossFit? Anybody knows a friend? Know anybody that does it? Do you guys know who Uncle Rabdo is? You guys ever heard of Uncle Rabdo? So that's the mindset of those who do CrossFit is how many times can you lift this kettlebell over your head so much that your muscles dissolve, they break down. That is rhabdomyolysis. They glorify that in their pretty much mascot, Uncle Rabdo. Pretty crazy. So rhabdo is striated muscle that breaks down. Lysis is to break or dissolve. And all those toxins in the muscles leak into the blood, and then the kidneys can't filter it out. You pee out Coca-Cola, kidney shut down, you die. So do not overdo it on your first day in CrossFit. Inflammation of the tendon, tendonitis. So if you ever played tennis, you may have had it. You guys heard of tetanus, right? Have you guys gotten your booster shot? Yeah, you get your booster shot how often? Every 8 to 10 years. To remind your body, hey, watch out for this stuff. So similar to botulism, this is going to produce a toxin. So the actual shot you're getting is a toxoid. It's not actually a vaccine. So it tells your body, hey, target this toxin, break it down, because it causes paralysis, similar to botulism. Here are the muscles of the face and jaw. Weary neck, torticollis, trichinosis, beef. What temperature should you cook beef? What internal temperature? Pork. Chicken. Do you guys know the internal temperature to ensure safety? You guys aren't sure? No. I like mine beef at 125, so anytime I cook a nice prime rib, I make sure I take it out at about 115, and then it'll continue to cook, and once it hits 125, it's time. Pork, I believe they want 165? I'm not sure. Nowadays, pork is a lot safer. I know chicken is 165. I think pork, you can go a lot lower nowadays. It used to be pork that was contaminated with parasites, the larvae for parasites, because they are in dirty conditions eating feces, and it goes into the muscles. If you don't cook out the parasites, then they can infect you. All right, that ends the muscle. Let's do week 3, day 1 together, I guess.